Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.
Well, welcome back, and today we have two guests on with Emere. We have Dr. Maren Rahimi. She is the medical director with Emere, and you've brought along a patient, which is always nice to have. Mr. Deboo, welcome. Nice to see you here.
For having me.
All right,
I
it's great to
appreciate it.
have somebody who has tried some of these treatments, and in just a moment you can tell us all about that. And welcome back to you.
Thank you so much for
Nice to
having
see
us
you again. And tell us a little bit about Emere. Last time you were on, you used to have you talked about it used to be called knee centers, but in fact, you do a lot more than knees. So you
Absolutely
changed the name on that. So
Yeah.
tell us a little bit about it and describe your pretty conservative treatments.
Okay, so Emere is dedicated to providing a more personalized and individualized treatments for patients who are suffering from any type of muscle or joint injury. And through our non-surgical regenerative treatments, we hope to help patients feel better and live more of a healthy and active lifestyle. And yes, our name was Knee Centers, and we have changed it to Emere because, as you already know, we do a lot more than just knees, and we wanted to communicate that effectively to our new patients with the broader spectrum of treatments that we offer. And so our name has changed to Emere Regenerative Treatment Centers.
Okay.
And although our name has changed, the staff is really the same. The commitment to your care is the same. And we are just really dedicated to providing excellent and personalized health care.
Now, I've been reading a little bit about this, and you deal both with joint pains or muscle pains as well. And I would imagine you would treat those slightly different. Or would this also include not only people maybe who have gotten an injury over the years, a long-term injury? What about people who have arthritis or something like that?
Yes, so osteoarthritis affects about 27 million Americans, and really depending on how hard you were in your body on your youth and some genetic predisposition as well as your current diet and exercise, your joints and your muscles are going to be affected by osteoarthritis and just pain in general. And so we have a wide variety of treatments to help patients who have muscle or joint injuries feel better. In addition, we have just highly trained physicians, nurse practitioners, doctors of physical therapy who hone in on getting the accurate diagnosis and then provide the correct treatment. And if our conservative measures don't work, then we are so well connected with orthopedic surgeons in the area that we accompany you on the next step, and there's no lapse in your care.
Okay, and I imagine some of the patients you have might have had these long-term injuries that have been nagging them for years and years and years, and that's where you can come in and help out. And we know things like arthritis are chronic conditions, and I just know from not myself personally, but family members, it can be quite debilitating at times.
It is quite debilitating, and in patients who have osteoarthritis of the knee, Mr. Deboo was one of those patients. We have different treatment modalities. One of them is joint fluid therapy, which is an injection of hyaluronic acid into the joint, and that's a naturally occurring compound. And what that does is that it makes the fluid that the knee bathes in more robust. And so now the bones are no longer grinding on each other, but they glide. And this is an FDA-approved injection medication, and it's covered by most major insurance plans. And patients like Mr. Deboo, although I'm not going to share his age, in his age category, really see wonderful results with the joint fluid injection therapy. In addition to that, we do PRP, which is platelet-rich plasma, and that can be injected into the tendon or into the knees. And we also offer stem cell injections. And stem cell injections are adipose-derived, and it comes from the belly fat, your own belly fat. And we have a team of physicians as well as a full-time PhD scientist and a laboratory where we concentrate the stem cells and then inject that into the appropriate joints. And we've seen clinically that patients have improvement in their pain and even their function and mobility.
Interesting. If someone comes in for these treatments, especially for arthritis, is it ongoing, like every month, every couple weeks, or does it just depend?
So it really depends. For the joint fluid therapy, the injections are given a week apart for 3 to 5 weeks. We get to see our patients' friendly faces once a week, and we monitor their progress. In addition to that, we have a medical weight loss program, and they come in weekly for that. And the body's a biomechanical unit, and the knees and the hips are the major weight-bearing joints. So as the patient loses weight, that also improves pain for the patient. And so under the guidance of the physician, the patients lose weight. We have a customized rehabilitation program with the doctors of physical therapy, and we have a nutritional program. So they lose weight, but also they maintain their weight loss. And really we help in just maintenance of this weight loss and lifestyle modification.
Very good. So it's very extensive. Mr. DeBoo, tell me a little bit about your situation, what it was, and how you came across going to Emere.
Sure. I read about it, that there was a seminar to be given by Dr. Rahimi at the Florence Sylvester Senior Center. And I attended, and it was very impressive. And my left knee has been bothering me for the last 40 years.
For 40 years?
Yes.
Wow.
On and off. I had a pain on and off, pain on and off, you know. And I decided to give a trial. I have nothing to lose, you know. So I called and make an appointment. And one thing I like about Dr. Rahimi's office is when you call some of the doctor's offices, the computer answers.
Right.
And then they will say, we'll get back. You know, sometimes you wait for 4 to 6 hours and you don't hear.
Yeah.
But Dr. Rahimi has a live person to answer telephone call, and you can reach her immediately. And so I like that part of it very much. And so then I started visiting, and she started giving me injections, you know. And she kept asking me every time I go, how much are you in per hour? I'll tell you next time. And finally we finished it up, all the sets of, 5 injections, including
the cortisone was separate,
with 5 injections.
So it's 6 injections
6
with the
injections.
cortisone. Yeah.
Okay.
And I noticed that I had the improvement about almost 75%.
Wow.
And in fact, I went for a dancing last Saturday. We had a Bollywood night, and you know, so it was kind of fun, you know.
Yeah.
Yeah, and whenever I visit her office, she has a wonderful staff. They smile at you and welcome you. When you walk in, say, would you like a cup of coffee or a glass of water? And they offer you.
So it's really been a great benefit to you.
Yeah, a great benefit. I like the staff, you know. The staffs are very polite and very pleasant.
Very good.
And that's the key, you know.
Yeah.
In one of medical practice, you know, the people who sits in the front desk, I mean, a receptionist, is the most important person.
That's true. That's very
because of the
true.
way a receptionist answers the phone, and the way she talks with you makes a lot of difference. That also gives the impression what kind of they are working for a doctor.
Yeah,
You know?
you're absolutely right on that.
Yes. So
So when our patients like Mr. DeBoo get better, you know, it really just reminds us as clinicians as to why we chose to be involved in this healing art of medicine, because we really share in their success, we share in their happiness and their goals. And really our whole staff gets very excited when our patients come in and get better. And it really is quite rewarding for us.
Now, will Mr. DeBoo come back for follow-up visits? or it just depends how he may be doing?
Yeah, we definitely do follow-up visits. After the fourth or fifth injection, we follow up in about a month time to make sure that they've continued to have improvement. And like we said, if there are other things that we can offer that can have him continue dancing and golfing and doing the activities he loves and enjoys. For us, we really are dedicated to giving the patients the freedom to do those activities that make them happy, and we monitor them closely. Also, like we said, that if there is something more that they need, we really triage their care and get them to the right place if necessary.
Very good. And if somebody wants to start on a program, do they have to go to their primary care physician first, or they just give you a call and then you work through their insurance program?
Well, it really depends on what insurance they have.
Okay.
But we suggest that they just call one of our specialists, and we can look into their insurance plans and get proper authorization and see if they need to contact their primary care doctor or not.
Okay.
And we would love to be of service.
All right, and your number's on the screen, 610-1040. Or the website is emere.com/regen, correct?
Yes.
All
and
right.
we're located just opposite the Laguna Hills Mall.
Okay.
I love to shop, so I go there on my lunch
So you'll be
hour.
excited when they redo that
Yes,
mall soon,
exactly.
right?
Across the Sears.
Yeah. All right. Well, very good.
Repair,
Mr. DeBoo, it's been a pleasure having you
Oh,
on.
thank you so
and,
much.
it's very nice to hear how
Yeah.
these treatments have worked for you. Very.
Yeah, I climbed up 26 steps too the other day, just 2 days
Wow.
ago. Yeah.
Very good. That would be hard for me. I think, so.
No, I don't think so.
Very
You're
good.
a young man.
Dr. Rahimi, thank you for
Thanks
coming
again
on.
for having
It's
us.
been
It
a
was our
pleasure to see
pleasure.
you.
Yeah.
And this sounds like a great treatment program that you have, an alternative. And as you said, if you find that someone needs something more than you can offer, you have a way to connect them to the right
Absolutely
people.
right. We
Very
sure
good.
do.
Nice to see you again. It's been a
Same.
pleasure.
Thank you so
very
much.
much. Folks, we'll be right back, and Marsha Wilson is here with her guest.
Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.